Hi, and welcome to That's Ready Mysterious. Join me for an intriguing look into real-life mysteries. Who was the mad gasser of Mattoon? What was whaling at the Wilga waterhole? I'm not going to solve those mysteries, but they'll be interesting to learn about. I'm your host, Kelly with an I. Transcripts and references for all episodes can be found at that'sreadymysterious.wordpress.com. No apostrophe and no exclamation point. Today's tale is about Fields syndrome, also called Fields disease. Lynn Fields told the BBC, "It's not this affliction that makes my beautiful daughters unique. It's the way they carry on without a hint of self-pity." Fields syndrome is a rare neurological condition that causes chronic pain and progressive muscle atrophy. It is the rarest known disease in the world, only affecting 2 people. It has a frequency of 1 case per 3.75 billion people. The 2 confirmed cases of Fields syndrome are 2 identical twin sisters from Wales. Catherine and Kirsty Fields were born on May of 1994. The symptoms of Fields disease began in the girls when they were 4 years old in 1998. Although the symptoms were being noticed so early on, the girls didn't receive a diagnosis until 2011. The Fields sisters are from Llanelli, South Wales. When the sisters were born, they had no known health problems. They went through normal growth milestones like crawling, walking, talking, singing, and riding bikes. By the time they were 7 years old, the girls needed walking frames to walk, requiring them full-time by the time they were 9 years old. By the age of 11, they spent most of their time in wheelchairs, and shaky hands made it difficult for them to write anything by hand. When they were 11 years old, they saw some doctors for their symptoms. The doctors were all stumped. They didn't know what was causing the symptoms. By the age of 14, the girls could no longer speak. By the time the women were 22, they were trapped in their home in dull and burn with no way to get out to the yard. There have been plans to expand their home to make it easier for the women to maintain their independence and to get into the yard, but the construction didn't happen. The family did get started on the renovations, but 3 years later, the builder didn't get the help he needed from assistants and had to stop. Lynn Fields said that they were desperate because the women had no privacy and only had a living room in which to spend time. The family had planned on building a combined lounge and kitchen area. Due to the construction on the home, the women were unable to get out of the house at all. Lynn said that they tried to get out of the house and do things, but that the pair are confined to the television at home. The newly constructed kitchen would have allowed them to cook. There are a lot of symptoms that go along with Fields syndrome. The disease comes with severe, constant pain throughout the body, especially in the limbs and back. The muscles in the body are weak and wasting, which leads to problems walking, moving, and doing daily activities. The twins also suffer from muscle spasms and cramps, which cause involuntary movements and contractions. They suffer from sensory issues like numbness, tingling, and burning. There are also cognitive effects. The Fields twins suffer from memory loss, confusion, and learning problems. Although the disease affects cognitive abilities, it does not affect brain development. The twins also deal with emotional and behavioral problems like depression, anxiety, and mood swings. They have problems with sleep, including insomnia, nightmares, and sleeping more during the day. The symptoms start in childhood and worsen as the patient ages. There is no known cure or effective treatment for Fields syndrome. The twins' life expectancies are unknown. To diagnose Fields syndrome, the doctor must combine both clinical examinations and genetic testing. The exam will show muscle weakness, wasting, and more than 100 spasms a day. Genetic testing should find the presence of the FLV-CR1 gene. The FLV-CR1 gene encodes the protein that transports a molecule called heme out of the cells. Heme is part of hemoglobin, which is the protein that carries oxygen in our blood. A mutation of the FLV-CR1 gene creates a deficiency in oxygen transport, which leads to a buildup of heme inside the cells. This causes oxidative stress and damages cells, especially nerve and muscle cells. However, we don't know exactly how the mutation of the FLV-CR1 gene causes the symptoms. Managing Field syndrome requires constant care and support. Patients need to have regular medical checkups and tests to monitor their condition and to prevent further problems. Medications are used to manage pain and other symptoms. Anticonvulsants, antidepressants, and opioids are used, but they all have side effects and may not be extremely effective. Physical therapy exercises, massage, and electrical stimulation are used to maintain mobility and function and to prevent contractures and deformities. Occupational therapy, including assistive devices and equipment, helps with daily tasks and to maintain independence. Counseling, therapy, and peer support groups are used to help cope with the emotional and social impacts of the disease. Relaxation techniques, distraction techniques, social supports, spiritual supports, humor and laughter, and finding meaning and purpose all help to cope with the pain that comes along with Field syndrome. The twins' mother, Lynn, said in 2005 that as the twins have aged, their condition has deteriorated. She explained that they have endured a lot of tests, including having their blood tests sent to Cardiff in Belgium and their scans sent to America. She said that they have been tested for all sorts of conditions, but that they don't have any of those conditions. She continued that their disease is not what makes them unique, instead it's how they don't have any self-pity. She says that they are smart and talkative girls with nothing wrong with their minds and senses of humor. By the time the women were 18, in 2013, they had entirely lost their voices and were relying on communication aids. They were also paralyzed. For their 18th birthdays, they received their communication aids, allowing them to converse again. The women chose different accents in their aids to make it easier to differentiate between them. Kirsty chose an Australian accent, while Catherine chose an American accent. Before losing their voices, both women spoke Welsh, but their assistive devices do not use Welsh. In August of 2021, at the age of 27, the women were the first to receive ultrasound Botox to treat their spasticity. Through her voice box, Kirsty said, "Don't feel sorry for us. Life is too short. No one lives forever. Be happy and smile." Some medical professionals think the condition is psychogenic instead of being physical. Others think it might have a genetic cause. Because the Fields twins are the only two people to ever suffer from Field syndrome, there is no standardized treatments. What causes Field syndrome, and how are the Field sisters the only two people to ever suffer from it? Is it a physical condition or psychogenic? Is it genetic? What do you think? Leave a comment and let me know what you think. Thanks for listening to today's episode of That's Ready Mysterious. Join me next week for another captivating mystery.